Get to know the very talented, caring, and dedicated providers at HSHS Medical Group, where we promise to offer patient-first care.
As a family medicine physician, I have to know a little bit about everything. It's basically the full scope of medicine, which is one of the things I absolutely enjoy about it. Born and raised in Haiti, I moved to South Florida when I was a teenager. I always knew in the back of my mind that I wanted to be a physician. I actually grew up with my auntie being a pediatrician back in Haiti. She was also my pediatrician, so I have that little bit of a background. I'm not the first doctor in the family. I went to undergrad at UW-Madison, so it's not my first time in the Midwest. I had a great time there. I went to medical school at Ross University in the Caribbean. My first job actually was outside of residency. I trained at Bronx Lebanon, and then I moved to Southern Connecticut, and I worked for Yale New Haven Health. I wanted to expand my practice, so this opportunity came up. My husband and I looked at it, we came, we visited, we fell in love, we bought a house, and we moved here. And one of the things that we do is we start seeing patients from basically day one. So I'm able to, in my practice, see patients from the time they're born. The other thing is we also see patients up through the entirety of their lives, including women's health, pediatrics, women's health, preventative medicine, as well as geriatric medicine. A lot of patients come, it's very common, like I want to lose weight, or I want to deal with my anxiety better. I want to get my blood pressure under control. Those are things that we can help with. More and more as patients become more educated about, again, preventative health, a lot of them come to me and say, look, my father had triple bypass before 50. How do I prevent that from happening? And I'm seeing a 25-year-old telling me that, and I'm excited. I'm like, yes, great. Let's work on, all these different aspects of your health, and let's look at them and see how we can modify, because there's a lot of disease modifying kind of risk factors that we can work on. So those are some of the examples of things. They vary, as you can imagine, from patient to patient coming in. I listen. I will never dismiss you. I listen, and I will listen to your story, and I will listen to what you have to say, and we'll have a conversation. I think that's very important. And that's one of the things that I think that I offer. That's one of the strong suits that I offer, is that I'm here to listen to what you have to say. We have on site Prairie Cardiovascular Health, who comes here weekly, and sometimes, most of the times, bi-weekly. We also have ortho outreach on site. We offer our own lab on site, and we can do rapid testing, such as rapid COVID testing, and we also offer imaging. I'm not sure that everybody knows that, but the St. Anthony's part of HSHS has a satellite office here where they offer imaging such as mammo and DEXA scans and CT and MRI and ultrasound and the likes. So it's truly a one-stop shop. We try to be very convenient for our patients, and I can pick up the phone and call, my colleague if I want a patient to be seen a little bit more urgently. Unfortunately, most people come to the doctor in their most vulnerable state. And just to me, that kind of responsibility in being able to be there for people in that state, whatever that may be, there's nothing like it. Being able to touch people in that way. Most people don't come to the doctor to say, hey doc, I feel great. It's almost like living out my mission in a way, to be able to reach out and say, okay, how can we help you? And sometimes I can't help, but most of the time I can listen and I can be there, and then I can see how, if anything, if any solution. So it's that human aspect of it to me, because anybody could be knowledgeable, right? The knowledge is there, it's out there, but the ability to connect with people on that level where they're kind of coming to you and saying, this is where I am, can you meet me where I am? I think that to me is what's attractive.
To schedule an appointment or learn more about the services offered by HSHS Medical Group, please visit our website,